Perfect. So if you just want to come and take a seat here and we'll have a quick chat. It's completely normal to feel embarrassed. With cervical screening, nobody likes it. It is an invasive procedure, but we'll basically take our time. I'm going to talk to you about lots of random things like the weather, what you do for work, and with obviously cervical screening, there's no need to be embarrassed. Nurses in general, I'm speaking for myself, we feel very privileged doing something like this, you know, helping to prevent cervical cancer as best as possible. So please don't be embarrassed. We've seen all shapes and sizes. So obviously if you're worried that you need to shave or anything before your cervical screening appointment, please don't ever worry about that. We see all different appearances and we are not fazed by any of it. So obviously if you're on your period, we won't be able to do your cervical screening today. The reason is because obviously if there's a lot of blood there, that can mess with the sample and the amount of cells that we take. So obviously when it's assessed in the lab, it can be quite difficult to check for things like HPV. So obviously we tend to wait for ladies to be off their period a week or two, and then we'll get you back and do your cervical screening then. For some ladies, cervical screening can be uncomfortable. Obviously, we would never want to intentionally hurt anybody, so I would always ask you, you know, just be open and honest. If it's painful, if it's very uncomfortable, just tell me, we'll stop, and we'll just basically take it at your pace. If you're a trans gentleman or if you're non-binary, if you have a cervix, you are eligible for a smear, so please always come in for your appointment. The main reason we call you in is to check for HPV and to check if there's any abnormal cells and things. But sometimes, obviously, we check for other things as well when you come in. So things such as polyps, Nabothian follicles, things that can cause you a little bit of trouble that we tend to refer you on to colposcopy for. So we tend to look for lots of different things when ladies come in for their cervical screening, not just looking for cervical cancer. If you ever have any questions about cervical screening or any abnormal bleeding, or if anything that's not normal for you, then please always contact your GP surgery and just definitely have a chat with someone if you ever have any concerns, and especially if something's not right for you.